Hello, my name is Joseph Gonzalez, and today I will be discussing and sharing some information regarding the current health policies in the United States. Health policy can be defined in two different ways. The first definition states that health policy is a statement of a decision regarding a goal in healthcare and a plan for achieving that goal. For example, to prevent an epidemic, a program for inoculating a population is developed and implemented. The second definition is similar in that it is a field of study and practice where the priorities and values underlying health resource allocation are determined. Now that I have given a brief overview of what health policy is, I am going to speak a little bit on the different policies that have been enacted around our country. Let me start off by describing who it is that creates and approves different health policies. First off, health policy does not only go through one branch of government, but rather through the federal executive, judicial, and legislative branches before it gets approved. Also, the state and local governments play a part in the decision-making process as they are given the opportunity to give input as well. There are numerous insurance plans that benefit individuals which fall under health policy. After extensive research and reading, the American Association of Health Plans, also known as the AAHP, continuously is a topic of interest and discussion. According to the U.S. Health Policy Gateway online website, AAHP is a national political advocacy and trade association with about 1,300 member companies that sell health insurance coverage to more than 200 million Americans across the nation. This association of health plans was formed through the merge of two health maintenance association trade organizations. The two organizations that merged together were known as 1. Group Health Association of America, and 2. The American Managed Care and Review Association. Another widely known health insurance plan that is advertised and used throughout the United States is called the Blue Cross and Blue Shield Association, also known as the BCBSA. The Blue Cross Blue Shield Association is a federation of 38 separate health insurance organizations and companies in the United States. Combined, they directly or indirectly provide health insurance to over 99 million Americans. That number is extremely high, marking about 1/4 of all of the United States population, which is extremely impressive. According to the Health Insurance Plans article on the Healthy Policy Gateway page as well, Blue Cross and Blue Shield insurance companies are licensees independent of the association, offering insurance plans within defined regions under one or both of the association's brands. As many people may already know, Blue Cross Blue Shield developed separately and at different times. Blue Cross provides coverage for service done in the hospital. Blue Shield, on the other hand, gives coverage to those who seek physician care. Now that I have discussed a couple different, yet popular health insurance plans that are used throughout the United States, I would like to go on to speak on some of the healthcare providers across the country. According to the online free dictionary, a healthcare provider is an individual or an institution that provides preventative, curative, promotional, or rehabilitative health insurance care services in a systematic way to individuals, families, and/or communities. A healthcare institution includes hospitals, clinics, care centers, and other facilities which house individuals. Individual healthcare providers may be a professional with a degree in medicine, nursing, or other similar health professions. One group of people that fall under this category is known as mental health practitioners. These groups of people are responsible for offering services to individuals for the purpose of boosting and improving mental health and or even treating a mental illness. A couple groups of these practitioners include psychiatrists and clinical psychologists. Another group of healthcare providers include maternal and newborn health practitioners. This group is responsible for dealing with issues and caring for women and their children before, during, and after the pregnancy of the mother. A few names associated with this group include midwives and nurse practitioners. Throughout the United States, over the past few years, there has been an enormous ongoing healthcare debate. According to writer Noam Levay from the article The Healthcare Controversy in a Nutshell, he states that the most controversial requirement in President Barack Obama's healthcare law is that all Americans get health insurance. The healthcare reform debate in the United States is intended to increase coverage while decreasing the cost and social burden of healthcare. The United States had the highest cost of healthcare relative to the size of the economy of the world in 2009, with nearly 50 million citizens still without health insurance coverage. In the year 2009, President Barack Obama proposed a few different strategies for the healthcare reform. He stated that electronic record keeping, preventing expensive conditions, reducing obesity, refocusing doctor incentives from quantity of care to quality of care, bundling payments for treatment of conditions rather than specific services, better identifying and communicating the most cost-effective treatments, and last but not least, reducing defensive medicine would be a step in the right direction. Also in the year 2009, both the House and the Senate passed two bills regarding the health insurance reform. The House bill that was passed was known as the Affordable Health Care for America Act. Two provisions included in the passing of this bill was one, prohibiting health insurers from refusing coverage based on patients' medical histories, and two, prohibiting health insurers from charging different rates based on patients' medical histories or gender. The other bill, passed by the Senate, was known as the Patient Protection and Affordable Care Act. The main provision of the PPACA was that guaranteed issues will require policies to be issued regardless of any medical condition, and partial community ratings will require insurers to offer the same premium to all applicants of the same age and geographical location without regard to gender or most pre-existing conditions. Both bills passed by the House and the Senate shared their similarities as well as contrasted in their differences. In my speech regarding many different aspects of the United States health policy, I have covered many different topics ranging from governmental issues all the way down into different healthcare providers and what their roles are in the world of health. As many of us may already know, health policies have been very controversial throughout the United States in recent times. Having said that, they have also benefited millions of Americans across the country by providing them with essential care, especially those entering the elderly stages of their lives. Groups such as the ones I mentioned, like Blue Cross and Blue Shield Association, have helped families struggling financially make it through times of difficulty when it came to their health. All of the information I have given today has been based on factual evidence either from my prior knowledge or from online websites and or textbooks. I hope that my speech was helpful in giving facts on current health policies and issues that the United States of America has been challenged with till today. I want to thank you, the audience, for taking the time to listen to my speech, and I hope that you took something extremely beneficial out of it. Thank you very much. Joseph Gonzalez.